Hi, and welcome to another installment of the Access California podcast series. My name is Claire Courtwright. I'm the Advocacy Director with Cal Voices. This episode of Access California is part 2 of the podcast on the United States Supreme Court's decision in the city of Grants Pass. Please watch part 1 if you haven't, so that you know what we're talking about here in part 2. To give a little bit of a recap, part 1 covered what was this important Supreme Court decision, City of Grants Pass, and how it is shaping behavioral health policy, particularly in California. Part 2 is related to local level advocacy. It is the mission of Access California to empower local level advocacy by the behavioral health community, persons with mental illness and or substance use disorders. So again, please see episode 1 of this podcast for the full explanation of what's going on here and why local level advocacy is critical and why there are opportunities for it. I'll touch briefly on the content of the first episode and then dive into the local level advocacy opportunities. So to recap, the City of Grants Pass was a decision by the United States Supreme Court just about exactly 1 year ago. And what it did was clear the way for increased criminalization of homelessness, especially in the Western United States. And this decision relates to mental illness and substance use disorders because those populations of people are disproportionately unhoused and they are a target of a whole raft of new legislation, both involuntary treatment laws that many of our listeners are familiar with, but also these new criminal laws aimed at those intersections of the unhoused and persons with specific disability, create criminal pathways, both through criminal charges and through threats of criminal charges, to move people into involuntary treatment schemas, either as a criminal diversion program that's formally part of the criminal court or through civil involuntary treatment. So we're all familiar with this by now: care court, assisted outpatient treatment, conservatorships. And this obviously both directly impacts members of our community, but it also impacts the behavioral health system, the public behavioral health system at large, and therefore all of us who utilize that system. And so how does any of this relate to local level advocacy? After this decision in the City of Grants Pass that removed protections under the Eighth Amendment, that cleared the way for all kinds of political entities, including the state of California, but also separately her cities and counties, to pass laws, especially local laws that only apply in that city or in that county, which are called ordinances. And those laws are being used to criminalize acts associated with being unhoused, like sleeping on the street with a pillow or blanket, or sleeping in your car overnight in a city park. And the support or opposition and voting on those local laws is an opportunity for local level advocacy. So that is the focus of this episode: local level advocacy and the Grants Pass decision, what's happening since the Grants Pass decision a year ago. So if you read your local newspaper, go online, follow accounts that follow local government and local issues in California, what you will see, most likely, because it's basically everywhere, is that it is cities and counties primarily that are passing these sweeping anti-homelessness laws. And these are criminal laws, and that are impacting behavioral health consumers. So in California, the state authorizes counties and cities to make and enforce its own laws, its city laws, its county laws, regarding many things, including police and sanitation and other ordinances and regulations, as long as what they're doing doesn't conflict with some state law or some other law. So what we're seeing after the decision in the city of Grants Pass is that the political bodies that are really driving the anti-homeless laws that are impacting our people is not primarily the state of California, it is cities and counties. And cities and counties are using their authority to pass local laws, to pass anti-homelessness laws. And examples of that include RV bans. You can't park your RV on a residential street. You can't sleep in your car overnight, no matter where you're parked. You can't, quote unquote, camp in any public place, and more. So we're seeing a profusion of this kind of law in the local jurisdictions throughout California. And how these anti-homelessness laws that are being passed at the local level impacts the behavioral health system is primarily because these threats of criminal prosecution for sleeping on the street or sleeping in your car, those threats of tickets and fines and jail time for these quote unquote crimes that involve surviving while being unhoused and having no other options and no place to go. Those are being openly advertised as tools or threats to force these same people to accept services, undefined, right? Services can be many things, even when, the crime that they're being, accused of and the services are totally unrelated. So I think this is a huge problem. It's a bee in my bonnet. And where I've seen this is really in Oakland, California, where folks were told, accept care court or we're going to tow your RV that you live in. And when we tow your RV to this private impound lot with, charges of hundreds of dollars a day to get it out and you're poor, you can't. So either you're going to accept behavioral health treatment because we think that you need it, or we're going to take your home away. And so this is hugely problematic. I mean, not just morally, but legally, I think it's hugely problematic. But it is happening. We are getting reports from our community members and allies and friends, and unhoused friends, telling us that this is what's going down. And of course, when you are using criminal laws, either as threats or as quote unquote diversion programs, so you accept court ordered treatment in order to avoid a conviction on your trespassing charge or on your sleeping in public charge. So when we're bringing folks in through the court system doors into our public behavioral health systems, meaning those that are administered by your county, funded by tax dollars, available to people who are indigent, people who are poor. Those systems have limited resources, and when we're bringing so many folks in through the court system doors into services in which they are not voluntarily choosing to engage, at least in the time, place, and manner in which they're being forced to engage, that eats up resources. And it eats up resources, on folks that don't want to engage in this manner and are being ordered to engage in this manner. And because these systems have limited resources and limited capacity, and they are actually severely underfunded still, no matter what anybody says, what ends up happening is that lots and lots of court ordered folks mean that there are fewer treatment slots, fewer available resources, for folks to access voluntary behavioral health services and permanent housing. So it's sort of like it's a zero-sum game. When criminal courts and civil courts are ordering people into treatment and it's all being funded out of one bucket, it necessarily reduces or eliminates access to voluntary services. And for folks with these disabilities, that want to engage in services in the time, place, and manner of their choosing, and they don't have access to that, what ends up happening is people decompensate. and they then become the target, especially if they become unhoused. They become a target of these criminal laws, and it's like a snake eating its tail. The more and more and more that we rely on carceral forms of quote unquote care, the more and more that that model reinforces itself as people lose access to voluntary services and decompensate and get criminalized or get placed in a civil outpatient commitment, and round we go. And you end up with a system that doesn't have access on a voluntary basis to high quality, culturally competent, um, accessible, patient, responsive, right? You end up with people who have needs that aren't being met. And as a result, they decompensate and they're criminalized. And this is hugely concerning, um, especially because the use of criminal laws means that our community members who are unhoused because there is no program to house them, there is no right for them to be housed by their state. There's no money that is sufficient to house them in an appropriate way and in a way that they would consent to. As a result of all of that, what ends up happening is a worsening mass incarceration of disabled people. And if you go back to podcast episode 1 on this, you'll understand why within the criminal injustice system, people with disabilities are mental health disabilities in particular, but also substance use disorders. They're disadvantaged, and people with mental illness are disadvantaged in the criminal justice system and its procedures that often traps them without being convicted in jail for long periods of time simply because they're deemed not competent to stand trial. There's a longer explanation of what's going on there in podcast episode 1, and I encourage you to listen to it if you want to know more about that. So, in sum, these anti-homelessness laws have a dramatic effect, not just on individual members of our community, but also on our systems and on the people who are not being swept up by criminal or civil involuntary treatment laws, but are simply trying to access services in the system more broadly. So, as I mentioned, one of the deep design flaws to involuntary and court-ordered treatment systems is that the funds for that and the systems for that are commingled, they're mixed together. And so one crowds out the other. And if you have a lot of involuntary utilization, you have a lot of court-ordered people, then there are fewer resources for people who are not in court systems. And these systems are already underfunded. And we're seeing this have an impact, particularly around Medi-Cal and Prop 1. Those policies are like nesting dolls. There's a little doll inside a big doll, and there's a little doll inside the medium-sized doll, like Russian nesting dolls. That's kind of how these policies work. So we have quote unquote civil involuntary treatment programs like Care Court or AOT or conservatorships that are now going to be funded inside of the Behavioral Health Services Act. So that's one layer of the nesting dolls. And then the next layer is that the Behavioral Health Services Act has almost entirely been subsumed into Medicaid. And so what you end up with is that our health insurance systems are being turned into carceral systems. They're funding these carceral systems, including, by extension, the criminal justice system. And these expansions of criminal and civil prosecutions of disabled and poor people threaten the viability of these systems in various ways. So, local level advocacy. Turning back to our mission to empower local level advocacy at Access California and what opportunities exist. To revisit, it is cities and counties primarily who are passing these anti-homelessness laws. And those cities and counties do have the ability to make their own laws for their own jurisdictions. And like the state, those lawmaking processes should be public. They're required to be public. The business of the public has to be conducted publicly. And so we have California's Ralph M. Brown Act, usually just called the Brown Act, that is going to require that these local level elected officials who are proposing and passing ordinances conduct a public process around this. And that means that you're entitled to notice an opportunity to be heard in the public forums that they convene, which are primarily, like a board of supervisors meeting or a city council meeting. That's where these anti-homelessness laws, these local level anti-homelessness laws called ordinances, can both be passed by lawmakers, but also repealed, also removed at the demand of local level advocates, if you're able to make the politics work for you on that. So how do you know what's going on in your local jurisdiction, what's going on with your city council, your board of supervisors? This should all be online. You can find agendas for your city council, your board of supervisors. You should be able to find proposed ordinances, public meetings, public meeting times, how to make public comment. You can show up at a meeting and you get very limited time usually to make public comment at those public meetings, usually 2 minutes. A public meeting law related to the Brown Act that applies at the state level has been interpreted to mean for disabled people that there has to be hybrid meetings, so hybrid online. So the meeting will be, in person in a public building, but it will also be simulcast on the internet, and you can attend either way, and you should be allowed to make public comment either way, either in person or online. If you are a person with a disability needing that online access and online public comment as a form of accommodation for your disability, or any barriers that you have being in person at that meeting due to your disability, even if it's one step removed, like I have a disability, so I have limited income and I'm unable to afford to travel to your location. That could be a disability accommodation to be able to make online comments and attend meetings online. Oftentimes, public meetings, like a board of supervisors meetings, will not only accept orally delivered public comment, but oftentimes they'll also accept written public comment. So if you have something to say, you may also have the opportunity to submit it in writing rather than attend a meeting or in person or online. So those are some of the forums in which these anti-homelessness laws that so affect our community are being considered and passed. And those are some of the ways that you can access those forums to let them know how these laws impact our communities. So that was a brief explanation of what's happening in the wake of the City of Grants Pass. And those are some ways that you can potentially be involved in local level advocacy to influence what's happening, or at least get a word in edgewise about how it impacts us. On the screen is also, you can sign up for the Access mailing list to receive more content like this. Keep in touch with our trainings, webinars, policy updates that are online to know more about what's happening with all of these highly interrelated policies that are being passed both at the state and local level. So as I'm supposed to say, please comment, like, and subscribe, share this content if you find it useful, and keep checking back on our YouTube channel on Cal Voices for more content in the future. Thank you so much, and until next time.